Emma Harper, who will be the last speaker in the open debate. Up to 4 minutes, please, Ms Harper.
Thank you, Presiding Officer. I welcome the opportunity to speak in this debate, and I welcome Scotland's strategic COVID-19 framework update. And just as I start, Presiding Officer, I want to be crystal clear that COVID-19 is still with us, and we heard that from the First Minister earlier today. And while vaccines are protecting us from the worst impacts of the virus, people infected do still require hospital attention, including intensive care support, although thankfully that is less than previously experienced. The publication of the updated version of Scotland's COVID-19 strategic framework marks the point at which we move away from legal restrictions and rely instead on personal behaviours, adaptations and mitigations. Personally, I welcome that face coverings, the requirement has been extended a wee bit, and that the other measures that have been put in place. It is an important point in our national journey through and out of the pandemic, and our return to normality must go hand in hand with a continuing determination to look out for and after each other. All of us have a part to play in ensuring a safe and sustainable recovery, continuing to follow public health advice on getting vaccinated, on testing as regularly as appropriate, wearing face coverings when required or recommended, and keeping rooms ventilated. All of this does still matter, even as we lift the remaining legal requirements. We know, for example, how successful face coverings have been in protecting each other from the virus. And for me, I think it's absolutely vital that we look at supporting and protecting people. And I know it's not as comfortable to wear face coverings, but we need to make sure that people who do want to continue to wear them do so and feel they can do that without fear of being judged. In fact, I would support any action to take or make FFP2 masks, which are more secure fitting, make them available, as they protect the wearer more effectively than other standard face coverings. The threat of this new variant, or the threat of new variants, does remain, and we've just heard that in the last 14 days. We've seen the emergence of a sublineage variant called Deltacron, BA.2. This is another variant of the SARS-CoV-2 virus, which appears to be even more transmissible than the already highly transmissible Omicron variant. And Dr. Adrian Esterman, who is a former World Health Organization epidemiologist, said that BA.2 variant is pretty close to measles in transmissibility, and measles is the most contagious disease we know about. So it's therefore right that the strategic framework update sets out how we will respond to future threats at a national level. And the strategic intent has been revised from a focus on suppressing cases to one of managing COVID effectively using adaptations and health measures. The adaptations and health measures referred to include vaccinations, treatment, surveillance, strengthening the resilience of health and social care generally, and adaptations to behaviours and physical environments. The update also sets out a clear framework of threat levels and potential responses that provides as much clarity as possible for planning purposes, but retains the crucial flexibility to ensure that responses are effective and proportionate. And I will just briefly highlight the support in mind briefing that we got ahead of this debate. We do need to continue to recognise how people's mental health has been affected during the pandemic, including for people that had a diagnosis prior to COVID. But I also acknowledge that a tailored, direct mental health support needs to continue as we go forward. And on vaccinations, I understand that currently 34.5% of people from Ukraine have had a first dose of the vaccine, compared to 73.1% of those in Scotland. So I'd be interested to hear from the Deputy First Minister how we can commit to helping people who are arriving, who we welcome from Ukraine, to access their first, second and, if appropriate, based on clinical need, additional doses. Finally, Presiding Officer, I support this motion today and I welcome this framework, and I look forward to the Deputy First Minister's response.
Thank you. And we will now move to closing speeches. I call on Alex Riley, who is joining us remotely, to wind up for Scottish Labour. Up to